Is there any laws today that have a future date where I'm going to need to track cereal dispensing to the patient?
No.
No.
That's a common misconception. People think that we're going to eventually track to the patient, but it's just tracking to the dispenser when it changes ownership. Once it's dispensed, tracking is not happening.
Our recommendation to our pharmacies is to start doing that. Right. If we import in, now that's the difference. Somebody asked today, what's the difference between integrated and non-integrated method? Yep. Integrated could mean we could bring those files on in and know, or even today, Pioneer, you can scan the 2D barcode and it'll store the serial number. It's not tracking inventory by serial number, but it'll store it. And that it gets you easy. There are reasons to dispense by lot and expiration, and that 2D barcode gets you that. So the serial number kind of gets you for free. So there would be value out there for people using that 2D barcode to dispense to a patient.
I agree. There's a great deal of value. If you have a problem with a drug or a recall, you can tell exactly where it is, what patient has it, and you can advise them. I mean, the whole system is about increasing patient safety. So if you can use the system to reach the patient directly if there's a problem, then there's an enormous amount of value, I think.
And really cool value, and be able to say, hey, I know the profit I made on that pill. Right? I know what that,
you're right.
I know what that serial number bottle cost me. I know what I dispensed for it. I really have that type of, we could probably talk all day about replacement cost versus average cost paid and that kind of stuff. But, certainly interesting, especially the high variability of, hey, this month I may buy generic at this price and next month I may buy it twice the price, and average gets kind of weird. Be that way. Well, that's cool. So what do you guys, I call you guys on November 25th and you get me set up and I'm ready to go on November 27th,
right? Let's back up and be realistic.
When hey, 20,000 pharmacies call you.
I want to start doing this, and no, you should have done. So what is the setup timeline look like? I mean, is it different per state like STC, or is it just you sign up and then there's like a 3-month process?
So the process is unique by pharmacy or chain or what have you. Okay. It's all based on your suppliers. So when the pharmacy signs up for our service, the first thing we do is get a listing of their suppliers. Who do you buy from? Your primary, your secondary, even those that you purchase from a couple times a year or not as often. We get a list of all those suppliers. We're currently connected to well over 300 suppliers, and that number is growing each day. So what we do is we reach out to each supplier. In many cases, we're already working with them, and we set up today an EDI connection. So when that pharmacy places the order, we get the T3 data or the 856, which is the electronic data for that product to store. That is where the time is spent, is how long does it take to build those connections with each of the suppliers.
Okay, so
the big guys, they turn around pretty quickly. Yeah.
So I sign up with you, and you have all but one of my suppliers that you're currently talking to, and you're getting the data back and forth. Can I still sign up? Or are you going to have to wait until you get the data from that other supplier?
You just after November 27th, you can't get product from that other one.
You just can't get product from that other.
Yeah.
Okay.
So if it's like, and that would be like a secondary wholesaler.
Yeah. Okay. And so you've got to find a new supplier.
Well, we have those 300 or so connections. Some of them we don't have connections for because none of our customers has requested it yet.
Right.
They're not going to make that connection unless there's a purchase happening. We're able to connect to all the suppliers. It's just a matter of when the customer makes
finding
that
a
request.
Customer, right. We get that. Finding a customer, like, we're not going to do this integration with this product unless we have a mutual customer using you.
I think it's important to remember that time frame when you're signing up. There's a time frame for implementation, but then there's a time frame for working with your staff to make sure they're applied, they're doing it properly.
Yeah. So it's not a big bang. So really people should be doing this today.